Hey guys, welcome to Pharma Palette. Have you ever wondered why blood in our heart never flows backward? What prevents it from going back during every heartbeat? The answer is the heart valves. So, today we will understand the valves of the heart in a way that you can directly write in your exams and never forget. So, coming back to the valves of heart, so, in the introduction, normally the heart contains four valves, and these four valves they are useful for regulating the blood flow. So, these will be ensuring the unidirectional flow of the blood through the different chambers of heart, and these valves will be preventing the backflow, which is also called as regurgitation during the cardiac cycle. So, these valves will open and close in response to the pressure differences across them. So these heart valves are located between the atria and ventricles. These are also present between the ventricles and arteries. So coming to the classification of this heart valves, these are divided into two groups. One is atrioventricular valves, which are also called as AV valves, and the other one is semilunar valve, which is also called as SL valves. These atrioventricular valves are further divided into tricuspid, bicuspid, and mitral valve, and the semilunar valves are divided into pulmonary valve and aortic valve. So coming back to the tricuspid valve, so the tricuspid valve is located between the right atrium and right ventricle. This is having three cusps in it. So one is septal, anterior and posterior leaflet. So these cusps will be attached to the chordae tendineae, which is further attached to the papillary muscles. So coming back to its function, this will be preventing the backflow of the blood from the right ventricle to the right atrium during the ventricular contraction. So coming back to the second type of valve is called as mitral valve. So this valve is mainly located between the left atrium and left ventricle. This is also having two cusps in it. One is the anterior and the other one is posterior. This mitral valve is also called as bicuspid valve. This is mainly supported by the chordae tendineae and papillary muscles. So coming back to its function, this will be preventing the backflow from the left ventricle to the left atrium during the ventricular systole. So coming back to the third valve, which is pulmonary valve. So this pulmonary valve is located between the right ventricle and the pulmonary trunk. This is having three semilunar cusps in it. This do not have this chordae tendineae portion. The main function of this is that it will prevent the backflow from the pulmonary artery into the right ventricle. So coming back to the last valve, which is aortic valve. This aortic valve is located between the left ventricle and aorta. This is also having three semilunar cusps in it, and this is also lacking the chordae tendineae portion. The main function is it will be preventing the backflow of the blood from the aorta to the left ventricle. So, coming back to the functions of valves during the blood pumping, especially during the cardiac cycle, this is having three main steps. One is the ventricular filling, which is the diastolic step, and the second one is the ventricular systole, which is the contraction phase, and the third one is ventricular relaxation. So, coming back to the first step, in the ventricular filling, in the diastolic phase, the ventricles will be getting relaxed. The pressure in the atria will be greater than the ventricles. So, here the AV valves will be opened, semilunar valves are closed. Now, the blood flows from the atria into the ventricles. So coming back to the second part, which is the ventricular systole. So this is the contraction phase and the most important phase. So here the ventricles will be getting contracted. So here the ventricular pressure will be increasing. This will be causing the AV valves to close. So whenever the AV valves get closed, we will be hearing the first heart sound, which is S1, that is lub. Then, when the ventricular pressure exceeds the atrial pressure, this semilunar valves will be opened. Thereby, the blood is ejected into the pulmonary trunk and then to the aorta. Now, coming back to the last portion, which is ventricular relaxation. So, here the ventricles will be getting relaxed. So, here the atrial pressure will be greater than the ventricular pressure. The semilunar valves will be closed. That is where the second heart sound will be heard, which is called as S2, that is dub. Then, the AV valves will be reopened when the atrial pressure increases. So that is all about the functions of valves during the blood pump, especially during the cardiac cycle. So when do we hear the heart sounds? So first thing, whenever there is the closure of this AV valves, we will be hearing the first sound lub, which is S1. And whenever there is closure of this semilunar valves, the S2 dub sound will be heard. So, to conclude, heart valves are essential structures that maintain the blood flow through the heart. Their opening and closure depends on the pressure differences during the cardiac cycle. So, proper coordination of this AV semilunar valves, they will be ensuring the effective pumping and produces this normal heart sounds. So, any defect will be leading to stenosis or regurgitation, which will further affect the cardiac output. So remember, valves do not actively contract. They simply respond to the pressure changes. If pressure behind increases, they open. If pressure ahead increases, they close. That is how your heart beats nearly 1 lakh times a day without blood flowing backward. If this explanation helped you, share it with your friends and subscribe to Pharma Palette for more exam ready physiology concepts. See you all in the next video and thanks for watching.